Doc is back. Welcome to Medically Speaking with Dr. Winston Alexis, hosted by Tyrone Robertson. Join Doc and his guests as they discuss healthcare and the Caribbean community every Thursday at 11:30 a.m. Eastern Standard Time on caribcast.tv, Apple Podcasts, Google Podcasts, and most other popular podcast platforms.
I didn't grow up here, but Broward County has become home to me. This is where I settled. I raised my family here and started my practice here. For over 20 years, I've represented my neighbors, people who needed help in a stressful time. If you find yourself in need of an attorney, reach out to someone you can trust, someone with a proven track record.
When a car accident or personal injury sets you back, call Scott McCullough.
954-989-3435.
Hello, ladies and gentlemen, and welcome to this week's episode of Medically Speaking with Dr. Winston Alexis. Doc.
Yes, what's going on? What's going on? Other than the pandemic.
Well, you tell me.
I know one thing. I ain't going nowhere. I have a perimeter. At least, I would say, at least 1, 2, 3 miles circumference around Orlando.
That's it?
Anyway, they have rallies with the chief.
We're not going there.
At least 3 miles circumference around, right? He was in Orlando, close to Sanford.
Yes.
I'm passing through there. I'm going on the road.
We're not risking it.
Yeah, but you know, though, Tyrone, one of the things that bothers me with this whole thing reflects a big problem we have with delivery of healthcare. Mm-hmm. I listen to some people, they question as to why they're going to these rallies with no mask.
Right.
And the answer is they don't understand what's happening.
How could they not?
Don't matter how, that's the point. Do not assume that they understand you. I hear one guy last night say, well, the reason is the flu is coming in and now the flu would bypass this. What the hell? You understand? You assume. And me as a physician, one of the reasons why we're here is I believe that I don't care how much the public don't understand about medicine. I have an ego big enough is I can simplify it.
Yes.
Because what I have found out, if people do not understand what is wrong with them, not by the name, to really understand what's happening, they're not in a position where they think they need to follow you.
Right.
Or
they're less likely to manage it or to seek.
That's why an obscene amount of prescriptions are never filled. They did a study to find what percentage in people draw. That means you go get it and you put it away.
Really?
Why? They don't understand why. And because they don't understand, they feel the doc is a quack. As a matter of fact, the question you asked me about a couple of shows ago, how to choose a good doctor. I'll give you an example. I'm just pulling things out there. About 1/3 of the time is spent with getting the history, meaning what the person complaining about.
Right.
About 1/3 at the time supposed to be spent with the exam. And consultation should be 1/3. I'm changing it a little more. I don't think that's right. I think at least 40% of the visit should be an explanation of what's wrong with you, what medicine I'm giving you, why it's going to work and how it's going to work.
Yes.
I have found that if patients understand even little what you're doing, they're more in tune with keeping the recommendations you give. Now, if you're going in and you're spending 1 second for the complaint,
yes,
2 seconds for the visit, and 5 seconds, the person leave your place sometime much more mesmerized than before. Right? So one of the most important thing I think we need to do as physicians, when I say we, I'm talking about providers. That means me, that means the x-ray people, that means the hospital staff. Let the person know what you're doing and why you're doing it. And if you're good, like I, you learn how to break all this tough language down into something people can understand. And that is, I hope they understand what this program has been all about. Educating anybody could look at high blood pressure, but they don't understand what high blood pressure is. Right. One lady really thanked me. She's saying, I didn't understand that's how blood pressure works. Mm-hmm. So the job is, and by the way, the patient has an obligation. You find out what's wrong with you.
Correct. And ask the question. And
ask him, and if you don't want to answer it, run out the door and look for somebody else. The way to test if he's a good doctor, ask him some question, and if he's annoyed or he can't say it, run out the door. Another patient came to me last week or week before. She in tears. The doctor wanted to do something, and she suggests, just ask, why do I have to do that? And he get vexed. So I say, and you went back to see him? You're mad.
No.
If you're asking for another opinion, he's mad because she went to another doctor about it. I welcome my patients to go, you know why? I know what I tell you is right. Me know where the hell you're going, but I know. So I'm confident you could go tell anybody, Dr. Alexis, you need operation, and let him tell you why you don't need it.
That's right.
He can't.
That's right.
Because I tell you how humble I am with this. I might sound, if I don't know, ask my patient, I tell them, listen, right now, me I know about this, but guarantee you, when you come back, I will know about it. Mm. What I don't know about, I go and make sure I educate myself. By the way, that's one of the reasons we could talk about this subject now. Diabetes. I'm a gynecologist, but I know about diabetes. And let me explain to you why. Black people have a lot of it.
That's right.
And I take care of black patients. So don't matter if you come for abnormal bleeding, part of our past history is to find out what kind of disease you have. And all of my patients, either diabetes, high blood pressure, or both.
All right.
So that's why I know some about this.
So let's talk about it now then.
Yeah.
So let's talk about diabetes. Mm-hmm. So if you could, in your special way, right. First of all, explain to us, what is diabetes?
Especially since I sort like my wife said, my big mouth telling you I know everything. So you tested me
I
then.
tested you.
All right. I'll give you it in down the street corner language.
All right.
Glucose is equal to humans, is like gas to a car.
All right.
Car can't go nowhere unless the car burning up.
All right.
You can't walk, you can't talk, you can't sleep, you can't think unless you have glucose.
Okay.
Glucose is your energy pill.
Mm-hmm.
All right. Glucose can be taken into the body in several ways. Either as pure glucose, or could be a byproduct of a whole group of things called carbohydrates.
All right.
Fruits, flour, bread, all the things black people like. Pasta, cake, ice cream. That sounds like a diet straight out of Africa. All of them have carbohydrates. And why we like it, it's sweet.
Yes.
And not only that, it does give you energy.
Which we need.
Yeah, if you look at all the guys who play tennis and things, the night before their game, they eat carbs like it going out of style. Big thing of ice cream, right? Because you could store some of it.
Okay.
All right? The reason you have to store it, if I eat today carbohydrates, my bloodstream take the glucose to all the things in the body. I use what I want. But if I sit down doing nothing, I don't need much.
Mm-hmm.
Unless we could store the rest of it, like a generator, or I don't know what they call it in the thing, where I don't know it, but you could store some of this energy for when you need it. If not, you're going to pee off the excess. The kidney is going to make you pee. That's why diabetics out of control, who have high blood sugar, what they do with it? Sugar in the urine.
Got it.
Right? So the body has a way not only to deliver what you need now, but it's to take the excess, take it to an organ called your liver. Your liver take it out and store it as a different product.
Mm-hmm.
Now later on, when you're ready to play some football or tennis, but you ain't eat long time, whoop, the liver break down that and give you back the glucose. That's how simple energy works in the human body.
Okay.
All right. What makes the sugar go in the cells to give you the energy? Remember the sugar in your bloodstream.
Mm-hmm.
Insulin takes the sugar, carbohydrate, put it in the liver, put it in your cells, put it in your brain, everywhere that need it.
Okay.
Without insulin, it doesn't go. It stays in the blood where it ain't doing no good and you pee it out. That's why diabetics out of control and always have whole heap of sugar in the urine. Right? So that's what insulin does.
Okay.
Right, you got that part straight.
Yeah. Sure.
All right. Insulin, you don't have to go to a pump like gas. There's an organ called the pancreas that makes this insulin. And every time you eat, the insulin jump out of the pancreas, get in your blood, distribute the sugar where it needs to do. But there's one other thing that insulin does. It makes your body retain fat. So in case you run out of sugar down the road, it could break down the fat to make you energy.
Gotcha.
That's not an ideal thing because when you break down fat, you make a poisonous substance called ketones that slowly...
What is that called again?
Ketones.
Okay.
And that could damage many things in your body.
Mm-hmm.
All right? So the ability of insulin to put your sugar in cells is important to your everyday being. And to lay down fat in case you need a little something.
Okay.
Right? And fat is your last resort.
Mm-hmm.
You get first from the liver when you need it and you're eating. And if things go bad and you're starving for 4 or 5 days, it starts breaking down the fat. You ever hear about a type of diet pill that causes ketosis? There are some of them.
Yes.
The HC Jet diet and things. They stimulate the breakdown of that storage thing called fat. So insulin doesn't only have to do with sugar. It have to do with how you think about most people who have diabetes are what? Let me use the decent term. High BMI. In parenthesis, fat. Right. That's how we don't use that word in my office. When you come, you have a high. I make my living for. Oh, your BMI is a little high. Oh, you're a little plump, but you don't use the word fat.
On the road, the road nowadays we call them fluffy.
Oh, I like that. That one even sung better. Right, but you understand what's happening here.
So, how and when does that now become diabetes?
Insulin there are 3 types of diabetes. One, you're born where you can't make no insulin, or you could make little. That's genetic. And there are certain things called autoimmune diseases. I've known you heard of that, where your own immune system attack things in your body. Well, there's a type of autoimmune where your own immune system destroy the cells that make insulin in your pancreas. Or disease can do it. Bad infection, viral sometimes can do it. Right? All of those are known as type 1. And type 1 means you have little to no insulin.
Okay.
That's only about 10% of the people. The vast majority have type 2. And what is type 2? Type 2 is you making insulin normal. Remember, 1, you have no insulin. 2, you have insulin, but your body is not responding well to it. What do I mean by that? The insulin goes to the cells. And when it tells the cells, take up the glucose for energy, the cells say to hell with you. It ain't taking it up properly. Right? It's referred to that as type 2 diabetes. Insulin resistance means the person have insulin, but the body is not utilizing it properly. That's what black folks type 2 is about, and most people in the United States. They're making insulin, but the body is not responding to it. 1.
Okay.
All right? And it's probably genetic. Only God knows why it happens. I think it's purely genetic. So the insulin goes and it said, take up some of the sugar, and the body cells say, go to hell. I ain't taking all, I'll take a little bit. So how the body responds, 1 minute. It makes more insulin to overcome that tough. And the extra insulin is what causes almost all the bad effects with diabetes. Because the extra insulin causes other problems. It causes you to build up fat. Remember what I tell you insulin do on the side? Mm-hmm. So the more insulin, now it's enough to override the resistance, but the extra is associated with obesity.
All right.
Okay.
All right. Ladies and gentlemen, we're going to take a short break, and we'll be right back to talk a little bit more about diabetes.
Urosurge Associates is a full-service urology practice in Plantation, Florida, with 3 board-certified urologists offering expert care in most disciplines of general urology. At the helm is Dr. Paul Kahn, who is board-certified in urology, a fellow of the American College of Surgeons, and an expert in robotic surgery. As a proud Jamaican American, Dr. Kahn attended medical school at the University of the West Indies and completed his residency at the University of Miami-Jackson Memorial. Since 1983, Dr. Kahn with his dedicated team have been committed to providing the best possible care to patients. Call 954-474-2929 to schedule your appointment today. That's 954-474-2929.
And we're back to Medically Speaking with Dr. Winston Alexis. Our topic this episode is diabetes, and we've spoken about the 3 types. Mm-hmm. We have the genetic, we have type 1, type 2.
And pregnant women who get diabetes. I didn't talk about that, I forget. That's the 3rd one. Type 1, type 2, and gestational diabetes. Quick to explain it. You only develop a mild kind of diabetes while you're pregnant. As soon as the baby born, it goes away.
Right.
And all it does is signaling in us that somewhere down the line you might develop type 2.
So is it a frequent thing for a pregnant woman after the baby is born to remain diabetic?
Most of the time, no.
Okay.
But over the years, it's telling you this person is on the way. All right? One of the important things about type 2 and type 1 is known as juvenile, because you have the cells to make the insulin. You have it from the time you're born with it. It's genetic.
Right.
So you find that in 12, 13, 14, 15, 16-year-olds, and it's bad. It's different from the one where you have insulin and that they're working right. This one, I have no insulin.
All right.
So type 1 is usually juvenile from then on. Type 2 only develops over a chronic overproduction of insulin over the years. That's why you don't get it till you're 40, 45, 50.
So when one gets a diagnosis that they're pre-diabetic,
right?
What exactly does that mean?
Well, I think it's foolishness, but the book has it. So I can't go by what I say. Right? What pre-diabetes is, listen, diabetes coming.
Okay.
It ain't no pre-something that you ain't going nowhere.
Right.
It's telling you better buck up. It's on its way. Remember, it take a long time to develop. Mm-hmm. From the day you born until you're about 40-something when type 2 starts. That process is going on. The resistance, more insulin. The resistance, more until you run out of insulin.
So, all right. So now you're getting into the meat of this thing then.
All right.
How, or shall I say, can this be prevented?
Number 1, early screening.
Mm-hmm.
And number 2, we're talking about type 2 now. Forget type 1.
Type 1, we understand. And we can circle back to type 1.
Lessen the amount of sugar in your system so there's no need for you to overproduce insulin.
Okay.
Make sense?
Makes sense.
What make you have type 2 eventually? All you run out. You're making overmake until you're 40. The poor pancreas is crying for help. Look, I can't do this no more, Somebody help me.
Mm-hmm.
And guess who helped them most of the time? Metformin. One particular, and I'll tell you how it works in a minute, but I want you to get the process. One is a slow process. That's where you have this pre-diabetes.
Mm-hmm.
When your body is now beginning to struggle to keep up with the sugar load.
So, all right, so let's talk about that for a few minutes.
Yeah.
So when you're diagnosed as pre-diabetic, can you take corrective measures at that point?
I want you to take it long before that. Right? I want from the time you find out you're black, you find out somebody in your family had diabetes, start the transition.
Okay.
Eat properly, exercise properly, and I'll tell you how that works. You don't wait till they say pre-diabetes. Most pre-diabetics, if you check them, they have diabetes in the family. And from the time you hear this family, you have to maintain the child's weight from the day they are born. Stop pinching them when they're chubby in the face and saying, oh, what a bubbly little baby. No, the baby fat. That's how it starts from birth. Regulate the sugar, carbohydrate content in people with a family history of diabetes. 1. Number 2, exercise your behind off. And I tell you how they work. The less carbohydrate you eat, the less you tax the insulin production by you. So the less it run out. Right? When you exercise, you burn up extra sugar. So what you do? The pancreas don't have to work as hard.
Makes sense.
You understand? So you are slowing down the process. And if you do it perfectly, you probably never will develop type 2 diabetes. By the way, I've never seen one human being who could do those two things and don't get type 2. There's too much good food in the world. So the biggest thing with type 2 diabetes, people do not eat properly. And I can understand why.
Yes.
And,
challenge.
Right. And when you come to our race, for 2 reasons, apparently carbohydrates is a mainstay of our diet. And then you add to it, when you get poor, cheaper food are more carbohydrate. So we hit twice. We have the gene, and then because we always in the middle to lower socioeconomic group, food. Right?
And that's a nice food too.
Yeah, by the way, the real rich people with steak and things, they get heart attack. Black people get type 2 diabetes because they eat no carbohydrate, they eat pure meat and vegetable. You ever watch the plate?
Yes.
My mother cooked 2.5 pounds of rice and 1 chicken for 11 people. I get 1 little piece of chicken soup, but my plate full up with rice.
Yes,
what?
Yes.
Guys, I don't want to name nothing before people sue me, but that's why when I go to a place, they ask me, more rice? No, I don't want no damn rice. I go buy me oxtail. They say, you want more rice? No, take out some. Take out some and put some cabbage and put more oxtail. What tell me more rice? So it's part of our culture. It's how we grow up, see. But again, if you don't have, like me, I don't care about them things. You have no diabetes, man. May have high blood pressure either. My wife said train works. But my family happen to have 2 things other than that. Prostate, and I get bite with that already. Mm-hmm. And my wife swear we have a little man gene somewhere in the Alexis family.
I believe that.
A mother's gene.
I believe
I didn't want to make it bad. My grandmother was local.
Yeah.
My mother.
That's what I believe.
Right. From knowing your friend?
Yes.
Not me, your friend. Are you all right? I stable.
Okay.
I know. Just don't ask me say if she think I'm stable. No, but genetics is really important. You hear us say that before. If you have high blood pressure in your family and diabetes, and by the way, they go together all the time. And it's amazing. Both of them need almost the same treatment. Low carbohydrate diet, exercise.
Question on that. So what other, health factors contribute to diabetes?
All right. Cholesterol. Increased cholesterol is not good for either diabetes or, and it doesn't do anything about the diabetic effect.
Okay.
Right? So let me get to that. What happens with all of this? So what happens if you don't have enough insulin? Or what happens? Your sugar go high. And the sugar is that destroy your heart. The extra sugar destroy your kidney.
Got you.
The extra sugar destroy. So that is the killer. It's not the insulin. Is when we can't control it, it get too high.
Got it.
And that causes all this. That's why people don't tell me my blood sugar, all right, you know. Doc is only 120. Oh, yeah? I mean 140. It's supposed to be 100. 90. And to them, 110 don't sound like much. It is. You got to keep your sugar exactly normal. You can't go to the doctor, he give you the metformin, you eat a barrel of grapes, but yet when you're ready to go to him, you starve yourself for 2 days and you go, your sugar look normal. You are hurting yourself. You're doing that to the doctor.
A great segue into my next questions. And so tell me again, what is considered normal, the normal levels, the normal blood sugar levels?
I think in America, almost labs in different countries have little, but ours here is somewhere around 100.
And is that the same no matter what age group you're looking at?
Yes. However, as we get older, the pancreas get old. It don't make insulin. So as you get older, like Mrs. is like 84, 85. I'm sure she gained a little bit of diabetes. Plus she have family history. Me, I have no family history. But my own, I expect to go up slightly. So technically, I should adjust my diet as I get older. Aging makes it worse.
Okay.
Aging, and if you never have it, you might begin to see a little bit because of your age. And the organ is getting older. So we're not worrying too much about the older people. That happens now. And it's mild. We're talking about the people who are genetically, and believe me, people, I'm going to give you all a break now. People who's overweight as diabetics catch hell to lose the weight. It's not because they ain't trying. You know what? Years ago, when I made a big mistake, patient used to come in, and I used to say, listen, you know, you're overweight there. But doc, I don't eat nothing. I say, wait, listen, give me a break. Give me a break. I mean, fat don't come from air. You have to eat some damn thing. But what they are trying to say, they eat almost regular.
Right.
But the way the insulin metabolism, laying down fat, lowering sugar goes, diabetics tend to be overweight. So losing weight is a real problem for people who are that. They ain't get diabetic because they're heavy. Yeah, they get heavy because they're diabetic.
Got it.
Right? So eating too much sugar don't make you diabetic. Right? But if you're diabetic and you eat too much sugar, you're in trouble.
So tell me about some of the, how would one, and let's not talk about screening just yet, but what would be a symptom or symptoms that somebody might see if, you know, they don't know that they're diabetic?
Unfortunately, by the time you get it, you're well into diabetes.
Yeah.
You drink too much. It's called polyuria. Polydipsia means you're drinking too much and you're urinating too much. That's a sign not of early diabetes. That is a sign of diabetes.
All right.
So the biggest thing is screening and family history.
Right.
Strong family history and ethnicity. For instance, the highest rate are in blacks. The second highest rate, I think, finally, we have something for we Indian and Chinese people in the country. Asians
have a high rate.
Very high rate.
Really?
Especially Indian, So you find high blood pressure is our own by ourselves.
Right.
But when it comes to diabetes, we share it with Asians. All them Chinese people. I think you call them Asian too, don't you? I don't know what I call them. I know Asian in Trinidad is Indian people. But Asian in Jamaica, wholly for Chinese people.
Chinese.
So whether you're from Trinidad or what, when I say Asian, you know what I mean.
So Mr. Chin most likely.
Oh, yeah, man.
Diabetic.
Yeah, as a matter of fact, one of my real good friends died very young with it. Unfortunately, it was back in college days he had it, and he never controlled it. He drink liquor and eat just like me.
Mm-hmm.
It's years after I found out he had diabetes when he was ready to die, and he just decided back then. We're now learning about insulin. He died young, I think 40-something.
Oh,
good friend, less than 50. He died right here in Florida, by the way.
Oh.
You know, so we have made strides. My people need to listen. Again, Tyrone. Family history.
Mm-hmm.
Start your children and them jumping rope and enroll them in all kind of extracurricular and teach them to eat properly. Right? And as you go along, once you have diabetics, diet becomes extremely important.
All right. Ladies and gentlemen, we're going to take a short break and then we'll be right back.
Dr. Ronald Moore and his team at Minimally Invasive Surgery perform laparoscopic robotic procedures with the utmost precision. As a bariatric surgery specialist, Dr. Moore performs a range of surgeries and operations focusing on areas and organs of the abdomen. For gastric sleeve, bypass, and banding, to endoscopic balloon and hernia procedures, call the Office of Minimally Invasive Surgery at 954-797-4220 to schedule your appointment. Minimally Invasive Surgery has 2 convenient Broward County locations to serve you. Call 954-797-4220 to schedule your appointment today.
And we're back to Medically Speaking with Dr. Winston Alexis. So, Doc, diabetes. And again, it seems to be a common theme. Screening.
Yeah, man, very early. Especially if you have family history, I'll start it as a child.
And how, as the years go on, how frequently should you be screening?
Once a year.
Once a year is sufficient? Okay. And then
and remember, we ain't waiting for the blood sugar to get high. So even while you screening once a year, you're exercising and eating properly before you're trying to prevent this or make it as mild as can. Mm-hmm. Can't wait till it come.
Right.
You have to go before it.
All right. So for the unfortunate ones now who are diabetic, let's talk again. I know we're repeating some of this stuff, but the management,
right.
So type 1, obviously we know that
insulin. There's nothing else you could do.
Now, what about some of these new things that I'm seeing that there are, these contraptions that you walk with and
okay. Let me talk about management.
Mm-hmm.
Many different types. The mainstay is we don't like to give insulin unless it's absolutely necessary because insulin have some downsides. 1, you have to inject. Number 2, the sugars are hard to control. Sometimes they go too low, sometimes it's not enough. It's better if you don't have to use injectable.
Got you.
All right. Type 1, sorry for you. You have to use injectable because you have none. Type 2, you have insulin, but remember it working over time. And the pancreas is going to run out of it the older you get.
Mm-hmm.
So we help the insulin. We give you a tablet that go to the cells and say, listen, shut your backside. Let the insulin work. That's how metformin work.
Got it.
It go to the cells and say, listen, get away from here. Let this insulin do what it has to do. So it helps the insulin.
Got it. So with that, is that a daily regimen or is it based? It is.
Why? Because you need the sugar every day in your body.
So what about this constant measuring of your blood sugar that I see some people doing?
All right.
Where does that come in?
Most of those are insulin-dependent diabetics. They are bad. Okay. They have to they're making nothing insulin, so nothing can help them. They need insulin.
Okay.
So they have to be monitoring insulin is much more difficult than giving somebody one of the helper tablets. That's why metformin don't hurt anybody in the world. But insulin, people used to go into coma because let me tell you a typical, I had to give you a joke in Jamaica. Right? You don't have to bring up some. I'm down in Jamaica, a Cornwall region now. Mm-hmm. And they had something because we didn't have too much consultants. when you're on call at night, you're on call for the whole hospital. You hear what I'm saying? I'm a gynecologist, you know.
But you're on call for the whole hospital?
Yeah, they don't care about that. It's my night. So one time, that's why God bless the nurses in Jamaica. They're the greatest thing I ever see. So one night they called me and said, Dr. Alexis, we have a lady here who's a diabetic and boy, it looked like she in a coma. I said, but to myself, I said, I'm a gynecologist. I know about thing below the navel. So the nurse and them said, Doc, don't worry, come. We're going to show you what to do. So I gone down there. Sorry, what will you do? They have an IV running. And they say, I hear the nurse say to one of the orderly, go in there and you're going to see a syringe. It have 50 cc's of sugar, glucose. Bring it for me. She stick the thing in the tube running in.
Mm-hmm.
And nearly run out the emergency room. The woman sits straight up in the bed too. And I said, what? They never teach me this in medical school. Sit straight up in the bed and say, Lord, thank you. I said, what? So the nurses and them laughing at me. I scared, you know. What is? I said, how you all know? Well, you never go nobody medical school. How will you know about this? They said, Doc, 3/4 of Montego Bay have diabetes. And a lot of them women take the insulin and don't eat. When you take the insulin and you don't eat, all the sugar come out your blood. So all they do, they take a syringe of sugar and squeeze it in. I never see that in all. So it's hard, it's difficult to control. Like when they take the insulin, you have to make sure they eat. They have to make sure they take the insulin on time, check the sugar. Metformin, if you take it and you eat, no big deal. You should eat, but if you don't eat, nobody's going to fall down and go into a coma. It's a helper. You still making your insulin. It's helping it so you don't have to overproduce insulin. But the whole idea of all of this is keep the blood sugar normal. Mm-hmm. That's our guide. If you have low blood sugar, you will not have the complications.
All right. So, what now happens when you have low blood sugar?
It damages your eye. No. You low. You might feel fainty. And you go just like they do in Jamaica. Everybody who is a diabetic need to have some orange juice around. Or better yet, a Kit Kat bar. You know them Kit Kat? From the time you feel weak, eat a piece of it, guaranteed, and you will wake up. If your blood sugar get low. Blood sugar low does not hurt the human body, except you may faint and bust your head when you fall down on the pavement. But it doesn't interfere with your organs. High is different. High destroys your cardiovascular system. That's why you could get stroke. Destroy your heart because of cholesterol. You understand what's going on here? Make you blind. Mm-hmm. Interfere with your blood vessels so they have to cut off your foot. So the complications that occur is because the sugar is too high. So it's important to keep it close to normal if you are going to avoid the complications of your cardiovascular system, your kidney. The sugar itself does that. And we at one time, we didn't know this, you know. We used to keep the sugar almost correct when I train. A woman come here with blood sugar like 120. Oh, where you wasting my time for? Go home now and look, eat less. Now, they want it exactly what it's supposed to be. That's the whole idea.
So that brings me to another question then. So as a physician, and I mean you're well advanced in your career.
Hey, stop that. Don't you mean you're telling people I'm old man?
I never said that.
Yeah, well advanced in your career. And people know it take
I did not say that.
100 years to go to medical school and now advanced.
I didn't say that here.
I am though. I am. As a matter of fact, I'm 1 year older next week, Monday.
All right.
And I'm panicking, man. I'm panicking it.
No, don't panic.
What do you mean? What do you mean?
Like a fine wine, man. Get better with age.
Yeah, you talk that foolishness. Like my knee hurt, my back hurt, my neck hurt. I peed too often. You could talk all that stupidness. You better drink all your fine wine early. Because when you get, I don't care. Oh, I feel young still. Oh, yeah? All right. I feel for my bed
Yeah, but
and my clicker.
But you look good.
That's because you make me laugh. You bring me out to fed sometime.
Yes.
And you're keeping me young by being around young people. That's the only thing I would promise.
Yes.
Yeah.
All right. Well, you're welcome.
Okay.
So back to this thing though. So you said when you were training,
Yeah.
your thing was to keep, close enough.
Almost. As long as you're in a coma, you're
Right. So when there are changes like this in the medical field or in research, how is the average physician, I guess, notified of something like that? Or
the first thing we do, we begin to see it in our journals. That's why if you have a doctor who's not going to conferences every now, not read, you don't understand. I'm reading now more than I read when I was a resident because I was in the middle of it. Now, I don't have half the kind of complexity of the patients I had when I was training.
Mm-hmm.
So I have to read. We keep up to date. Normally, when it first comes out, we get it in all our magazines that they're working on it, like the vaccine.
Right.
All right?
Okay.
Then you see it coming in more magazines.
Mm-hmm.
Then you get a little thing through the mail, say this thing has been improved, and explain to us why. The reps come and explain to us how it works, and we get updated on it. Okay. That is, on the average, a year to 2.
Got it.
From the time the discovery is made.
Okay.
And if you're smart like me, I find out when the discovery make, and I start doing it before it even come out in the books.
Okay. Well, that's interesting because... So another tip there, ladies and gentlemen, you need to speak to your physician about what are they doing to keep themselves current with their particular area of medicine.
And what are you giving me? Metformin?
Why?
Doc, yeah, and how it work.
Mm-hmm.
And if he can't answer you, run out the door. So you get the longest part of a consultation, of a visit, should be the consultation. If you find that's the shortest part, run, you need somebody else. Yeah. Right? And I have been criticized for being too slow in my office. That's why. I sit down and my wife talk is because I like to talk. It isn't. I explain to my damn patient. I kind of like to talk to, so that make it easy. Right?
That's okay. You're allowed. Other medical issues.
But you had asked me about just now some other medications.
Yes.
We see them on TV every night.
Right.
I don't even remember the name of them. I hear so much of them. With your diabetes. It's your metformin plus that.
So what is the plus?
It's not one or the other. What they do, what metformin do, force the cells to utilize your insulin better. These make you pee out some of the sugar.
So in your estimation, is that helping the whole situation?
Yeah, combination of both.
Okay.
The only thing, brand new set of side effects. You better find out before you use it.
Right. Okay.
But there is some use. Anything that will help lower this blood sugar without really bad side effects is good. So a lot of people, the standard is 2 drugs. Either one called glyburide or one called metformin. Metformin is the more popular one because almost no side effects.
Okay.
You could literally give it 500,000. All right, glyburide a few more, and these newer ones that come to help the helper. Right, metformin is the helper. These help the helper.
Okay.
These new ones by reducing the sugar load. The whole thing is to get the sugar down low. Insulin doing some, metformin helping insulin. These new drugs peeing out some of the sugar. Overall, what is the end result? Low sugars. Okay. And there is very little danger in your sugar becoming too low. Too low is better than too high, anytime at all. And if you, as I say, carry a little Kit Kat or one of them, you notice I ain't say dark chocolate. That's healthy. Kit Kat is the one that tastes good. So every time you feel faint, take one of them small bar. All right? But the point is, I want people to have a general idea and what the disease is.
Yes, yes.
And by the way, walking and eating properly, not going to prevent it. It's going to lessen the effect it has. And it will be a minor disease, maybe most of your life rather than a major one. So, because people in the island always talking about cure, when they going to understand most of the diseases in the world we cannot cure, we can make your life a whole lot more comfortable. We can get you to enjoy the quality of life. You must think doctors mostly save life. You're wrong.
Manage.
We make you. And you know what's the number one problem in the United States of America? Chronic illnesses.
Mm-hmm.
Not the cancer you're thinking about. You're going to die, your ovary, your belly, your pancreas. It's your bad knees and your diabetes and your high blood pressure will make your life miserable, walking with a drag in your leg because you have a stroke. Yeah. You're blind because of the diabetes. So people concentrate on chronic illnesses. And you know what is amazing about them? Every one of them include, by now you should know the mantra, eat properly, exercise, and reduce stress. So that's why I tell you, I tell my wife, that's why I want to go back to Jamaica. I want to reduce some stress. When I was down there, I wasn't stressed.
In the country, we have less stress.
Yes, man. Especially in the bush where I was.
Of course. Where you were is not bush anymore, though.
I know one of my biggest stress was reaching happy hour after the guys leave. That was one of my stress. I seen my last patient in Bobby and I said, Jesus, look at the time. The boy must have gone already. I went there to relieve stress until about 9 o'clock in the night. I didn't go home in my house.
All right.
No, but we need to learn to do that. And again, I'm bigging up my friends. We have some promoters that have the greatest sessions I've ever been. And I'm an old man. So you could imagine all your young people. I dance up and drink up and laugh and meet my old friends. So you see, again, you already.
Yes.
When time reached and, let me talk no politics. When time reached and things change, I hope.
Yes.
I hope. They might take criminalize me and let me talk no politics and deport me. That might be a bad idea too. Yeah. Then I have to go home. Then my wife have to go. She said the only way she's going is involuntarily. Her dress.
At the rate you're going, it could happen.
No, man, I always, you're right. Let me talk about no politics here.
Ladies and gentlemen, thank you very much for joining us. This is Medically Speaking with Dr. Winston Alexis. New episodes every Thursday at 11:30 a.m. Eastern Standard Time on your favorite podcast platforms. All right. Ladies and gentlemen, Medically Speaking with Dr. Winston Alexis is produced and presented by the Caribbean American Connection. Thank you again. We'll talk to you next week.
For the absolute best obstetrics and gynecology care, call South Florida OBGYN at 954-452-4377. Schedule your appointment today with Dr. Winston Alexis, who has been serving the women of South Florida for over 25 years. Conveniently located in Plantation, Florida, the courteous and professional team at South Florida OBGYN are standing by to assist you. Schedule your appointment today by calling 954-452-4377.
We appreciate your time with us on Medically Speaking with Dr. Winston Alexis, hosted by Tyrone Robertson. Join us next Thursday at 11:30 a.m. Eastern Standard Time on caribcast.tv, Apple Podcasts, Google Podcasts, and most other popular podcast platforms. Doc is back. Although the host and guests are qualified professionals, they assume no responsibility for inaccuracies, omissions, inconsistencies, and any slight of people or organizations. Listeners should use their own judgment or consult an expert or their personal physician for specific applications to their individual medical problems.